Hello, everyone, and thank you for joining us. My name is Carly Gabriel, and I work in media relations for UNC Health and UNC School of Medicine, and I'll be facilitating this Q&A session this afternoon. To answer your questions about COVID-19 vaccines, we have with us a panel of physicians and researchers with UNC Health and the UNC School of Medicine who can address a range of topics. Dr. David Wall is a professor in the Department of Medicine, an infectious diseases specialist, and medical director of the COVID vaccination clinic at UNC Hospital's Hillsborough campus. Dr. Lisa Rahongdale is a professor in the Department of Obstetrics and Gynecology and researches reproductive infectious diseases. Dr. Peyton Thompson is an assistant professor in the Department of Pediatrics and specializes in pediatric infectious diseases. And Dr. Samantha Meltzer Brody is the chair of the Department of Psychiatry and founder of the Taking Care of Our Own and UNC Wellbeing programs. And first, we're going to start with a message from Dr. Meltzer Brody.
Good afternoon, everyone. I'm delighted to be here today to answer questions and talk about the vaccines. We all appreciate we're living during a very difficult and complicated time, and there's many strong emotions and feelings about the pandemic, about vaccines. There's a bright spot. The Pfizer vaccine is now FDA approved. I'm sure we'll be able to talk more about that. But for the purposes of today, we appreciate that there's many emotions and we want to hear your concerns. There's validity to concerns. We want to hear your worries and fears about being vaccinated for yourself, for your children, for your family. So today is an opportunity for us to talk, to hear your questions, to have a real conversation with some of the best experts on the planet. We know that much of the information swirling around about vaccines out there, unfortunately, is not scientifically based, and there's an enormous amount of misinformation that is dangerous. So we want to get you the most scientifically grounded information. We also understand that many of the answers you will hear today may not relieve all of your concerns or not provide 100% reassurance, but you will get the most up-to-date and factual information possible. Lastly, it's very important for us to continue to have ongoing conversations. How can we help you understand the issues at hand, and that to reach out to peers, to your leaders, to managers is so important, to other experts that work within UNC Health to help you get questions answered. The current time is so stressful for all of us, and this is a critical moment to make sure we're taking care of ourselves, our co-workers, our families, and everyone around us. So please reach out for support if you're struggling in any way. And we have a UNC Health helpline, 984-215-5655. You can see it easily on the Wellbeing program for UNC Health. And if you're concerned at all about how the stressors we face now are impacting your well-being, or you need to speak to someone, we want to make sure you reach out. So I look forward to hearing from my terrific colleagues today and hearing your questions.
Thank you, Dr. Meltzer Brody. So we'll get started with answering your questions now. And just a reminder that this session is dedicated to questions about clinical safety and efficacy of vaccines. We've had many inquiries from teammates about vaccines in children. We know that's important to you, so Dr. Thompson is happy to answer questions on that topic as well. You can enter your questions during this session into the Q&A box on your screen. And as you begin doing that, we'll start with a few questions that were sent ahead of time via email. Dr. Wall, I'll direct this first question to you. As Dr. Meltzer Brody hinted at, the Pfizer vaccine has now been fully approved by the FDA. So what should that tell us about the safety of this vaccine?
Yeah, it's really interesting, Carly. I think there's a few things this approval shows us and demonstrates. One, importantly, is the independence of the FDA. They've been under a lot of pressure to approve the vaccine sooner, yet have not, insisting that they needed to review the data, and they were trying to do so as quickly as they could, but that they needed time to do a good job, and they did not want to rush. So I think that we've seen, despite the tremendous pressure from people like me who say, why don't you approve it? You're going to approve it anyhow, just do it. It'll convince maybe some people to get vaccinated who are on the fence. They did the right thing. And they're doing the right thing by waiting to get the full data set for the Moderna trial and then approving Moderna if they agree that the data look great. So I think that's the first thing. The second thing is it does show that the data they reviewed was more than satisfactory for them to approve and give a rubber stamp of approval that this is good. This is clearly, as we've seen from not only the clinical trial of over 40,000 people, but millions of people who've gotten this, not tens, hundreds of millions of people who've gotten this. And really, there's no smoking gun. It really works. And anywhere where there's vaccine, there's a decrease in death from COVID-19. So I think that they did the right thing. I think the signals really strongly that this is a really, really safe and effective vaccine. And, the number of reasons that a person can have to not get vaccinated just went down by 1.
Thank you, Dr. Wall. So Dr. Thompson, this next question is for you. There are still no vaccines approved for children under the age of 12. If I get vaccinated, will that make a difference in protecting my own kids from COVID?
Thank you for that question. And my answer is a resounding yes. So we know that the best way that you can protect your children who are under the age of 12 is to make sure that those around the child who are eligible for vaccine are vaccinated. You're not only protecting your children, but you're also protecting others who aren't eligible, your child's classmates at school, other people who have weakened immune systems. I would also encourage you to convince people around you who spend time with your children, be it grandparents, aunts and uncles, friends, older siblings, to get their vaccines as well to help protect the younger children around us. We have a responsibility to protect our children and to do what's right for the public's health as well as for our children's health collectively.
Thank you, Dr. Thompson. So, Dr. Rahangdale, this question is for you. One person writes, I'm concerned that there is no long-term data representing the effects of this vaccine on the body or unborn children. How are we sure that vaccines are safe?
I think that's a valid point. It's impossible to have long-term data on this particular vaccine, but we do know that we've been using vaccines in individuals for decades. And to back up a little bit, we use vaccines or recommend vaccines, give vaccines to women who are planning pregnancy, who are pregnant, and who are breastfeeding for as long as I've been practicing. So decades of data. The way the vaccines work in general is that vaccines stay in your body for, around 72 hours. And then in that time period, they cause an immune reaction, which that is what lingers. And given the experience we've had with other vaccines, the COVID vaccine should behave similarly. But there's no way that anybody can give long-term data on this specific vaccine.
Thank you. So we'll move on to our next question. Dr. Wall, we're going to go back to you. We've actually had a couple of questions just based off of some of our answers already. So Dr. Wall, folks want to know if the vaccine does not prevent transmission, then how does it help others if you personally get the vaccine?
Yeah, this is a terrific, terrific question. So thank you for asking it. And now, I don't know how many people are on the call. It says 115, but now you're all going to be deputized to share this answer. And then, almost like an infectious disease, you will spread the truth so people understand this, because this is very confusing to a lot of people. So just give me a minute to explain it. This is really important. So the vaccine does a few different things. Let's just be very clear. The number one thing it does is it teaches, trains, primes your immune system so that if it ever does encounter the germ that we're vaccinating against, your body can react swiftly and aggressively. Otherwise, if it does not, the germ gets the upper hand. So let's be very clear. The vaccines work really, really well for COVID-19 in doing that. Your immune system is primed, your immune system is ready, and it's on guard in case the germ enters your body. It does not create a magical force field around you that doesn't let the virus penetrate it and get into your nose or throat. So if the virus does get into your nose and throat, what it does is it gets a jump start on reacting to it. But for a period of time, there is going to be virus in your nose and throat. And because Delta is so good at evading your normal immune system, your unprimed immune system, it already has a lot of virus in your nose and throat. Your regular immune system just is not going to help out. It's just your vaccine-induced immune system that's going to respond. So first of all, we see that when you do look at vaccinated people, it seems like they're protected from infection. Maybe not 100%, but somewhat. They're just more protected than unvaccinated people. If they do get vaccinated and they get infected, the amount of virus in their nose and throat drops down quickly, as you would expect if your immune system's primed and ready. If you're unvaccinated, it takes many more days for that virus to clear out of your nose and throat, if it clears out of the nose and throat at all. It drops down slowly. If you're vaccinated, it drops down quickly. If you're vaccinated, it doesn't go down into your lungs and cause pneumonia. If you're unvaccinated, there's a really good chance it's going to go down into your lungs and cause pneumonia, and that's when people get sick. So just to put it together, it protects you somewhat from getting infected in the first place. Even if you do get infected, it shortens the duration of your infectiousness and makes it very much less likely that you're going to be symptomatic. And if you are symptomatic, probably mild symptoms. And it prevents people from getting severely ill and dying. It's still true to this day that well over 95% of the people who are in our ICUs are unvaccinated. So when we talk about breakthrough, for me, breakthrough is I got sick and I'm really, really sick with COVID-19, even though I'm vaccinated. And that is extremely rare.
Thank you, Dr. Wall. So we'll go back to Dr. Thompson for this next question. The Pfizer vaccine is still under an emergency use authorization for people ages 12 to 16. Should I be concerned about my teenager receiving a vaccine since for that age group, it still is not fully approved?
Thanks, Carly. And first, let me say that if I had teenagers, they would have been the first in line to get this vaccine back when it was approved for emergency use in May. The clinical trial results are excellent in these teenagers. For Pfizer and Moderna, the efficacy was over 95%, 100% when you looked at the initial Pfizer data. And the safety data is really reassuring as well, with no serious adverse events reported. So I'm really confident in the safety and efficacy of these vaccines in teenagers. Further, the number of teens who are vaccinated in our country support this. So almost 50%, last I checked this morning, it was 47% to be exact, of teens in the US have received at least one dose. So that's many hundreds of thousands of children who have gotten this vaccine and been totally fine and who are now protected. At the same time, I do understand that there's hesitancy among parents to accept a vaccine that isn't fully approved for their children. You have to keep your child's best interest in mind, right? And the regulatory process does take some time, as Dr. Wohl referred to at the beginning, but I would expect full FDA approval for teenagers in the coming months. And just to provide some reassurance in the meantime, we use many medications in the hospital before they're fully approved. So remdesivir, which is an antiviral that we use in the hospital for moderate to severe cases of COVID, is used still for children under emergency use, and even among infants in the hospital, as long as they weigh over a certain amount. I have yet to encounter a parent who refuses remdesivir for their child when they're sick with COVID in the hospital, despite it being under emergency use. And so just in sum, you have to do what's best for your child. And if you ask my opinion, what's best is to get them vaccinated and protect them from the devastating effects of COVID, because we know that COVID can kill children as well as adults. And we feel very confident in these vaccines.
Dr. Thompson, just a quick follow-up question that we got in the Q&A chat. What about myocarditis in male teenagers who have received the vaccine? How common has that been, and how concerning should that be?
Yes, I figured that question would come up as well. And I'm happy for others to chime in as well if you have other things to add. But what we know about this myocarditis picture is, first of all, it's really rare. And then second of all, it's very short-lived. So these children will have some inflammation of the heart muscle, the myocarditis picture, but then in almost 100% of cases, it resolves, and pretty quickly too. So I've heard of a few cases, come in through the ER, be seen by their pediatricians, but then within a few days or a week or so, they are completely better. Whereas with COVID, and specifically MIS-C, which is the post-COVID inflammatory syndrome that we see in children, I have seen kids very, very sick. The sickest kids I've seen with COVID have MIS-C, and the vast majority of those kids have changes on their echocardiograms, have heart inflammation, have systemic inflammation affecting multiple organs. And so that is far worse, in my opinion, to get COVID and to have heart inflammation from that than to this rare risk of myocarditis from the vaccine.
Would anyone else like to comment on that? Okay, great. We've had a couple of people join us since we started. So just a reminder, we are having a panel of UNC Health and UNC School of Medicine physicians and researchers answering clinical questions about the safety and effectiveness of COVID-19 vaccines. And you can enter your questions into the Q&A box on your screen. And this is being recorded and will be shared widely afterwards. And we'll also work to gather up all the studies that have been referenced here to share that as well, so that you can do some research for yourself too. So our next question, we're going to go back to Dr. Wall. Dr. Wall, a couple people have asked, now that there are therapeutics that are showing to be effective against COVID-19, why are we still requiring vaccinations? And folks have specifically asked about hydroxychloroquine, ivermectin, azithromycin, and vitamin D. So can you maybe address some of those as well?
Yeah, I think there's two big questions there. And the first is, if we have good treatment, do we need vaccines? And I would say, I think the importance of vaccines may end up being maybe somewhat lessened once we have good treatment, but we don't really have great treatment right now, unfortunately. And so we have monoclonal antibodies, and I know there was a question about that. If you Google UNC monoclonal antibody, up pops a really nice, succinct page that with a video that tells you all about monoclonals, and those are available for people who are sick with COVID-19 but not hospitalized, and they have been found to modestly decrease the risk of going on to end up in the hospital and of dying. But they're not magic bullets, and it's not, as former President Trump said, liquid gold. It helps, but it's not perfect. And very much so, we have a flu shot, which is marginally effective, right? We know it's about 40% per year because the technology is old. It's not like an mRNA vaccine, so it's clunky. And we still have Tamiflu, but we still get flu shots, even though we have Tamiflu. So I think that there's really a need for both treatment and prevention. An ounce of prevention is worth a pound of cure. This is true. So I think vaccines are going to help. No therapy is likely going to be without its own risks. Because everything has a side effect, right? As we talked about, even rare side effects. So how do we know a treatment won't have a side effect? Probably will. And I'd rather not take the chance that it won't work. Regarding the medications that you mentioned in the question, the data on them are either showing that they don't work. In the case of hydroxychloroquine, it does not work. We did a study funded by the NIH. It does not work. And others have looked at it as well. And in places where they're using it, they're not seeing great results. That's number one. Number two is there's really very little data right now to support ivermectin or azithromycin. And vitamin D, the studies really point to people who have low vitamin D levels being more at risk for severe disease. That's very different than taking vitamin D to treat something. People with low vitamin D levels generally are sicker and have comorbid conditions that place them at risk for severe COVID. So it's true and unrelated. So again, I'll just very briefly, I'm an AIDS doctor. I've been doing this for 25 years. I had patients who wanted to take all sorts of things, some of which made some sense and had laboratory data, tree bark, other things like that. We were very hopeful. It didn't work. And when they wouldn't take the new HIV medicines because they thought they were toxic, they thought it was a conspiracy, and they thought that pharma was trying to rip everyone off, and they didn't trust them, they took those medicines. And I'm sorry to say, you know how this ends. They're not here anymore. And I just don't want to see history repeat itself.
Dr. Wall. So Dr. Meltzer Brody, we're going to go back to you for this next one. Maintaining mental health during the pandemic has been a challenge for many, and the decision to get vaccinated can be emotional and can cause anxiety. In this extremely stressful time, what are some ways to manage those emotions in order to make an objective and thoughtful decision about getting a vaccine?
It's a really important question. People are very scared right now. People are worried about their families. They're worried about their kids. They're worried about their kids returning to school. They're worried about the vaccine mandate. There's just lots and lots of worries. We know factually that rates of Delta are going up, that more people are dying and more people are sick. And for those of us working in a hospital, the hospitals are filling up. And I think that it's really important that we try and get scientific information. Unfortunately, so many people live in worlds, all of us do, on the internet, where you're reading a lot of things that are just not true, or you're hearing things from family and friends that are meant to be scary. The Facebook world can be very scary with things floating around. And I think it's important to really get away from that and try and stick with what's scientific and evidence-based. Certainly as healthcare workers, we work in a place where we really try and rely on that kind of data. So it's important to have to trust that the data we have and the scientific data we have, while not perfect, is much more perfect than something that a cousin thinks they heard on a talk show somewhere that you read on Facebook. And there's so much misinformation that's meant to be alarming. A lot of it has really evil motivations. A lot of it can be motivated by things other than people doing things that will allow them to stay safe and keep their families safe. All of this can be very stressful. There's lots of families having huge amounts of fights and discord about vaccination, lots of fear about kids and what this means, and that can be extremely unpleasant. So I think it's important for each person to figure out what are they going to do to manage their own stress. One of the things that can be most helpful is trying to unplug from all the chaos, to really stick with factual information that's coming out of scientific journals and not off of sketchy news shows, or things that, someone that has nothing to do in the scientific world is just espousing because they heard it somewhere. And to do things that are stress reducing for you, whatever that may be. So that may be, for some people, exercise or spending time with friends or family in a safe way, or enjoying walks with your dog, or whatever it may be, but really trying to hunker down and take care of yourself and your family during this time. Reducing stress for all of our healthcare workers is so important, because we know right now that the staffing shortages are making it really, really challenging for all of our teams. So reaching out if you're feeling stuck, we have a lot of resources for people. We know this has been a very long, intense, difficult time, and we want to be able to help. So the Wellbeing Resources site has a lot of great things that can be of help to you. There are free hotlines and different things available to help with you understand how to manage your stress and get additional help as needed for yourself or your families.
Thank you, Dr. Meltzer Brody. So Dr. Wall, we're going to come back to you, and we may stay with you for a little bit because we've got lots of questions in the Q&A chat that I think you would be good for answering. So can we just kind of start, Dr. Wall, with maybe going back to the basics of this COVID vaccine? Some folks have voiced some concern. Is it possible that they could transmit COVID after getting the vaccine? And also, why would a vaccine provide better antibodies than, let's say, having had COVID and having natural immunity?
Yeah, good question. So the first, of course, is no, there's no live component here. There's no virus that's being injected into someone. There are vaccines that are attenuated, what we call attenuated viruses, so weakened viruses. This is not one of them. The vaccines here really all try to do the same thing. They're trying to use your own cells to make some proteins that the virus has on its surface, and just the surface proteins, so not anything else. And so those surface proteins, your cells start to make them temporarily, and that introduces those proteins to your body, and your body says, whoa, that's not me. That looks foreign. I'm going to make a reaction to that, and I'm going to remember that reaction. If I ever see it again, I'm going to kick it out of town. And so that's exactly what these vaccines do. But that spike protein that's created by your cells, it doesn't last very long. You know, we can't have our cake and eat it too, or whatever the negative analogy is. You can't be worried that vaccines are going to wear off, but they're going to cause long-lasting side effects. Like, it's either one or the other. In fact, we're more concerned that the vaccines are just going to start diminishing in their efficacy because of antibodies waning. You know, so there's no persistent protein that's being created. And we know that because we're even thinking about and giving boosters now. If there was protein that was continue to be made, you know, that would be a problem. So no, it cannot cause COVID-19. It just doesn't have the mechanism. And what was the second part?
Why would a vaccine provide a better immunity response
Natural
than
infection.
natural
Yeah,
immunity?
funny enough, it's really interesting. So theoretically, we thought that vaccines they're designed to create spike protein that's pretty generic. So like the spike protein from alpha and beta, you know, and delta, you know, there's some commonalities there. And so the idea was that maybe we can get good immune responses that go across variants. And we weren't sure if the vaccines would actually do that because we don't know what variants are going to come. Turns out they do. There's a really interesting study just published the other week from Kentucky that showed when you look at reinfection, so this is people who were infected last year and now reinfected more recently. If you were vaccinated, much decreased risk, substantially decreased risk of getting reinfected. And these are documented reinfections. This is not just self-report. This is they have your virus from back last year, and now they see a different virus this time. And it's really remarkable. So I think we have evidence now that the vaccines produce a super good response against COVID-19. And people who survive COVID probably have a more narrow immune reaction to the variant that they got that isn't as broad as the immune reaction they get with the vaccine. So that's a bonus. That's value added. We didn't know that the vaccines would actually do that, but there seems to be an Achilles heel across the variants that the vaccine is able to take advantage of.
Thank you, Dr. Wall. And thank you, everyone, for all of your questions. We really appreciate your engagement. There are quite a few questions that we answered in our last session. So we will share those answers in communications during the next week. And we will stick to some of the new questions that we haven't yet gotten to. Although I said that, I think we will, Dr. Wall, go with something we talked about last time, just because there are a lot of questions and concerns about this right now, which are breakthrough infections with the Delta variant, and how are our vaccines holding up to it? Do they have a lesser response? And why are vaccinated people getting sick enough to end up in the hospital?
Yeah, this is a really important question. So the good news is there's good news and bad news. Bad news is Delta's worse. Delta is worse because not so much that it evades our vaccine protection, But Delta's worse because when people get Delta, there's just so much more virus in their nose and throat. And when they have more virus, they can spew out more virus particles to infect people. So some of the things we've been doing beforehand may not work as well. And, we maybe need to be a little bit more distant than we thought before. Maybe 3 feet doesn't hold for Delta. So that challenges things. So it's a hyper infectious virus. And that's the way we have to look at it. When people are vaccinated with the Pfizer, Moderna, or Johnson & Johnson vaccines, they are protected definitely against infection, but it isn't as good as the other variants. The vaccines do not protect against the infection as much as we saw before. That said, what it does protect against is getting really sick. So New York has looked at their cases of people who got infected without getting really sick, and their cases of people who got infected and got really sick pre and post Delta. And as I just said, when you look at infection, there's more and more people who are vaccinated more recently than before. So that shows you, but still there's an effect. We can totally see that unvaccinated people still are more vulnerable to infection, but vaccinated people were having some of these breakthroughs. So how well is the virus protecting us from just getting it in our nose and throat? Maybe about 50%, almost like the flu shot. Okay, that's number one. But when you look at serious illness, hospitalization, no change at all, 95% efficacy. That means 95% effectiveness. That means that of the people getting sick with COVID, enough to be hospitalized, 95% of them were unvaccinated. That did not change pre and post COVID. And it wasn't any different by age group. Young, middle-aged, and old, 95%. So it's really good news. The vaccines are holding up, doing exactly what we want them to do as like a last line of defense, even against Delta. So that's really important. If anyone says to you, why should I get vaccinated? People still get infected with Delta. That they don't understand that, they get infected with Delta somewhat more likely than before with the other variants, but so much less likely than unvaccinated people, and they don't die. So really, and remember, if someone does get vaccinated, it's like my grandfather who lived to 96 and he smoked all his life. Does that mean smoking is okay? It's not. But, some people will have breakthroughs and have serious outcomes because the vaccine doesn't work 100% in everyone, right? We keep talking about 95%. If you're immune compromised and your immune system doesn't react to the vaccine and you're 81 years old and you're on prednisone and you get into the ICU with Delta, that makes some sense, right? Because they didn't respond. We know some people won't respond to the vaccine, thus the boosters, which I'm sure people have questions about too. So I hope it's clear. I know it's complicated. It's hard to break down into chunks, but just, bottom line is the vaccines do work against Delta, and they really are still holding strong in protecting us against getting really sick from Delta and transmitting it to others, as I said, because it gets out of your system quicker.
So much, Dr. Wall. So we had a similar question last time, but I think it's worth revisiting with each one of you. So the question is, how can I feel comfortable with getting the vaccine if there's still doctors and nurses who speak against it from a medical perspective? So let's go to each one of you, starting with you, Dr. Wall, and maybe comment on this and, what is your viewpoint of this? How do we manage this kind of thought process? And why is it important to get the vaccine even if there are people you work with who are against it?
Healthcare providers are people too, and they have their own thoughts and information and biases. I think you have to look at the trend, not the exceptions. I think you look at the middle 2/3 and not the outliers. And I will tell you, the vast majority of health workers, especially those who deal with COVID-19, are vaccinated. So you can find, the Minority Report, you can find the squeaky wheel who, is a contrarian, but I think everyone appreciates that the huge majority, I'm sure if you go to ICU nurses, you would have a hard time finding an ICU nurse who's taking care of COVID-19 patients who says, I don't think this is a good idea. In fact, it's the opposite. ICU nurses are pissed. They can't believe that people still are not getting vaccinated, and they're spending, countless weeks, months, taking care of patients who come in who are unvaccinated. So I feel it's the opposite. So please don't get led by the outliers. And I think that's what's happening too much. Outlier reports on Facebook, disproportionately amplified on Instagram, on social media. Really go with what your gut tells you and what's happening around you. Just open up your eyes. People who are not vaccinated are dying, and people who are vaccinated basically are not. It's really very clear.
I'd love to hear from some of the other folks on this call about this as well. Dr. Meltzer Brody, how about you?
Well, unfortunately, I echo everything Dr. Wall just said. The overwhelming majority of all healthcare workers across the country are vaccinated. The overwhelming majority. And you're not going to find 100% agreement on anything, at all. And so I think that, it's the overwhelming majority, the scientific evidence. And unfortunately, you're always going to find a few people that will, have disagreements with whatever it may be. But those voices, as Dr. Wall said, it's just become, unfortunately, facts don't necessarily matter at all in the social media world. And Uncle Larry or Cousin Susie or, whoever it is working at the five and dime store, their opinion now matters more than scientific facts. And these things get amplified. And then they'll throw in a nurse or a doctor that said something somewhere, and suddenly that gets equal weight with the overwhelming majority of the entire medical profession. And so that's just incredibly, incredibly unfortunate. People who are concerned and hesitant about vaccines are going to latch on to things that support their point of view, because they're going to be latching on to support things that say, I'm worried about this. But I think at this point, and with the Delta variant, the facts are just the facts. The hospitals are filling up. Our healthcare systems are getting overwhelmed. We have now many more of our healthcare workers, and as a psychiatrist, who are falling apart under the strain of caring for the Delta surge. And people have left the profession in droves, and the staffing shortages are real. We need all of us who work in healthcare to listen to the scientific evidence, to do what's right, to take care of ourselves, to take care of our families, to take care of people we don't know that we could infect if we're not doing the right thing with vaccines, and to help us move forward as a society out of this.
How about Dr. Thompson?
Thank you. I think the important points have been brought up is just, in this social media world, and I'm not on social media, so I can't honestly comment on what is out there aside from what friends and colleagues tell me. But, it's so hard to know what is true on social media, what's real. And so I just encourage folks to go to sources that you trust, and go to your doctor, have ongoing conversations with them. And again, the voices of a certain few are being amplified more than maybe they should be. And I think that we just have to know who we can trust and who we can't.
Dr. Rahang Dale?
Yeah, I'll just add, well, how do you decide what sources to go to, right? That's one thing that's hard. And the last time we had this conversation, I brought up how we all learned how to use the library when we were kids, but none of us learned how to use the internet. And, and so when you look at the lone, doctor or nurse that's being quoted, are they really the ones being quoted directly, or is it something being taken out of context? Is when you look at the sites, are there a lot of advertisements on those sites that might be supporting some other aim of that person who's posting? And, just like everybody else said, we need to, focus on where are the vast majority of people in our profession going towards. The vast majority of individuals have made their mark by being the first to go get vaccinated in our country, right? And also our professional organizations that are all overwhelmingly, unanimously, I would say, coming out and saying the vaccine is recommended in all populations where there's emergency use, approval for. And so that's where you look for the information.
Thank you all. So Dr. Wall, we'll go back to you. I hope you have some water nearby. Thank you for answering all of these questions. So some folks have a question about if they're going to get a vaccine, how do they decide which vaccine is the best one or the one that is right for them, since now we have a little bit of a choice for us? And also, is there any guidance on whether the yearly flu vaccine can be given at or around the same time as a COVID vaccine?
Yeah, these are great questions. It just goes to show people are thinking really hard about this, and I appreciate that. And always having, frank, honest, respectful discussions is just totally welcome. So thank you. I think, first of all, the flu shot, and there's no problem with getting the flu shot around the vaccines. Early on, when we were giving vaccines, we tried to avoid giving other vaccines around the same time so we didn't confuse side effects. Again, that just shows, just how careful everyone was trying to be. But now we have a lot of data, and there doesn't seem to be much of an issue with the COVID-19 vaccines, as we've talked about, such that we feel it's totally okay to get a flu shot at the same time or near the same time. So that should be okay. And we don't want people to delay flu shots because they do work. They definitely save lives and keep people from getting sicker. Again, analogous to some of the things we're talking about. As far as choosing the vaccine, this is a tough one. And I go back and forth on this. I'm a big fan of the mRNA vaccines. I really am. Yeah, it's a new technology, but I'm okay with that. I'm okay with new technologies, especially new technology that, over 200 million people have taken in the United States and turned out to be pretty okay. So I think it's a good thing. Most people in the world are literally dying for a chance to get an mRNA vaccine. I think they've turned out to be really potent and really nothing that I think makes me feel that there's any sort of downside to them. The J&J vaccine, I like the J&J vaccine. If it was the only vaccine around, or you really, really, really only want one shot, that is why you should get it. But I do have a little bit of concern that maybe it isn't as potent, given some of the data we've seen against the mRNA vaccine. So I'm going to be honest with you. If you have a choice, I would edge towards the mRNA vaccines. And to be honest, I think some of the data we're seeing says that maybe Moderna might be just a little bit more potent than Pfizer, but that's kind of controversial, and we have to look at those data a little carefully. We might be splitting hairs here. So bottom line is, get the vaccine that you can, but if you have a great choice, and we're fortunate enough and privileged enough to have a choice, go with an mRNA vaccine. That's my personal bias. That's not what you're going to hear from every infectious disease person or COVID expert, but that's how I feel.
Great. And one question that just came in, Dr. Wall, is a very good one. This person says, if we never reach herd immunity on a global level, how will we ever defeat the virus?
No, it's a really big thing. So, we're not going to see, the end of global COVID for years. I mean, we're just not, we don't have that kind of leadership. We don't have that kind of programming. It would be great. I think we do have an ability to do that, but, it's just not happening. So here's my vision of the future. I think we're going to get to a point where we do get more people vaccinated by hook or by crook, by one way or another, mandates, or just people finally, just saying, I'm going to do it, whatever. We're going to get more people vaccinated, and we're going to get better treatments. And my vision and hope is that a year from now, COVID-19 is a nuisance. You get COVID-19, you go through half a box of tissues, you're vaccinated so you don't get really ill, but you get called in an oral medicine that you take for 5 days and knocks it out and doesn't let you get sicker. And there's hardly anyone in the ICU. Sound familiar? It's called influenza. People die of influenza every day during flu season. Pregnant women, old people, younger people, it's horrible. But we don't shut down our society because of influenza. And we didn't even wear masks, although maybe we should have, and maybe that would have saved lives. But we have a pretty okay vaccine, and we have a pretty okay treatment. Now, influenza is different. It hasn't killed 600,000 people in a year, so COVID's more deadly. But if we can minimize COVID's dangerousness, if we could get it down to something like flu, where we have good vaccination uptake and good protection, and boosters when we need it, and treatment for those who do get sick, maybe this could be something that's just a pain in the butt and keeps you out of work, but not a deadly threat that keeps everything shut down.
Thank you, Dr. Wall. Dr. Thompson, we'll go back to you for this next question. So now that the FDA has fully approved the Pfizer vaccine, there could be a chance that doctors prescribe off-label the vaccine for children under 12. Can you talk about this and maybe advise parents about this?
Sure. So I actually did an interview on WRAL this morning about this exact question. So it's becoming a common question. The official stance of the American Academy of Pediatrics, and what I stand by, is not to use the vaccine off-label. We have trials for a reason. We need to know what the right dose is for children of different ages and weight ranges. We dose pediatric medications and vaccines based on weight. So it's really important to know where we need to go here. We need to see all the data. We need to go through the same regulatory process through the FDA in order to have public confidence in these vaccines for kids. We would hate for something bad to happen because it's being used off label, and then we've lost confidence and we've lost that ability for some children. So it's really important that we go through the regular route for children for approval for these vaccines. I mean, I do expect it to be in the coming months that we see vaccine available for the 5 to 11-year-old population for emergency use. And so I would just encourage people to be patient in the meantime, as hard as that is, and especially with kids starting school and seeing COVID in schools and seeing these outbreaks. It's very challenging, very frustrating. And I think we all want to see these vaccines come out for younger and younger populations, but just try to be patient. In the meantime, what can you do? You can wear masks, especially indoors in public places. You can have your kids wear masks at school, and you can have everyone around your child get vaccinated.
Thank you, Dr. Thompson. So how about, and I'll take an answer from anyone about this, since you all may be able to talk about this from personal experience. If someone's going to get vaccine and they are afraid of side effects, is there anything that they can do to maybe moderate any of these side effects or prevent them, or if they do get them, to help with it? And what are some common side effects that people could expect? Well, Dr. Thompson, we can start with you.
Sure.
If you're okay to talk
I'm
about
happy
this.
to start. And so I'll speak about the side effects in general. They're pretty much the same in kids as we see in adults. And so you can expect to have some local pain at the site of your injection. Some people get some redness as well and some swelling. Rarely people get lymph node swelling in the area. And then fatigue, headache, those are probably the next most common side effects. And then fever. I, for one, got a fever after my second dose of vaccine, and I was thrilled about it because I knew that my immune system was working. I had the whole 9 yards. I had body aches, and I was tired, and I had a fever for the first time in years, but I was thrilled about it. You can ask my husband. I was a little worried at first because I was one of the first to get vaccinated, that if I took Tylenol or Advil, might that reduce my response to the vaccine? But I wound up taking both Tylenol and Advil, and I was fine. And so I would take medicines. I wouldn't take them preemptively, but as you need to help deal with some of these side effects, and so that you can go back to work when you need to, and that sort of thing.
Dr. Meltzer Brody, I'm curious to hear your thoughts from just a mental health approach. The worry leading up to it, whether you will have side effects or not, can sometimes be worse than the actual thing.
Yeah, we call that anticipatory anxiety. And so people have heard any number of things. I also, with the first one, felt okay other than a sore arm, and the second time had a low-grade fever and aches for a day, and was thrilled about it as well, because I also thought that was evidence of my immune system working. I think that in general, there are many things that we get very anxious of, but it's always about risk-benefit ratio, and what are the potential serious long-term outcomes. I think what we've heard today and what just is factually is that the risks of something bad happening with the vaccine that are lasting are tiny, and the benefits are massive. And I think really hanging on to that, this is something we've gotten as healthcare workers. We've gotten flu shots required, for years. We've gotten other vaccines over the course of our lives. And I think this has been made to be much scarier, but the reality is the anticipatory anxiety, if it's really overwhelming, then seeking out help. Again, we have a hotline. You can call and talk to someone about that, figuring out how we can get around that. But I think that the benefits of doing this for yourself, for your family, for your kids, for your community, for our patients are so overwhelmingly positive. It's a small thing to do, and it's our way out of the pandemic. So it's so important. And I think the realization that you are doing something that is important for all of us can help get over that worry.
Dr. Rahangdale, do you have any advice?
Well, I think that it's a tricky situation for individuals who are pregnant, because the advice that we give to pregnant women is don't take anything unless you need it. And even we know that there are medications that are safe in pregnancy, but in general, the philosophy for pregnant women is to avoid exposures. But we always have to, again, balance risk and benefit, and the balance here is that we need healthy moms to have healthy babies, and pregnant women are at significantly increased risk of ending up in the ICU with a breathing tube or dying, compared to somebody who's not pregnant who gets COVID. And so therefore, we clearly recommend the vaccine in pregnancy. We also have data that supports that getting COVID during pregnancy increases your risk of preterm birth, which again, both of those things will impact the health of your baby. And so given what we know about how vaccines work, and that we have also data that shows that there's antibodies, the antibodies that a pregnant woman produces cross over the placenta to their baby, that potentially could protect their baby. There's a benefit that we've also found towards the pregnancy. So between all of that, it is hard to kind of put those things in perspective when the messaging is always to the focus on your baby. But we have data that supports that keeping mom healthy will keep her baby healthy, and ultimately potentially benefit the baby's protection from the infection as well.
And a quick follow-up question. Someone asked, is there a specific trimester that you would encourage people to get the vaccine during pregnancy? Because one person says their provider encouraged them not to take it in the first trimester due to the effect that fever can have on the fetus. So can you speak to that?
Sure. So very high grade fever, like 104 or something like that, for a long period of time is thought to have concern during pregnancy, particularly during organogenesis in the first trimester. And so that might be why this person talked about avoiding it in the first trimester. We've heard about, the usual side effects from the vaccine, which is usually a low grade fever, but certainly that is probably the rationale that was given. Many times providers will tell women to avoid things in the first trimester because it is a risky time in the pregnancy, where individuals who may have had a miscarriage inevitably happen will then attribute whatever exposure they had to to their miscarriage. And so many times in general, things are avoided in the first trimester just so that those two things are not conflated. And otherwise, if there is no ideal time to get vaccinated, because the time is now, because the Delta variant is now and the risk is now. And so I would encourage individuals who are waiting for the right time to just go ahead and do it.
Thank you. And Dr. Wall, we'll finish with you. And can you address reports of very serious side effects from the vaccines? And is there any concern for people with neurological issues, or have there been any reported deaths from directly caused by the vaccine?
Yeah, that's a good question. So remarkably, I have to say, it's been really interesting that association between really serious adverse effects from these vaccines have been very, very, very hard to find and very rare. So I know there's reports from like the vaccine adverse event reporting system. That's a system, as we pointed out last time, that providers can type in adverse events that occur in their patients, but also the public can type in their own thoughts about adverse reactions. So it's not exactly scientific. It's supposed to be a canary in the coal mine. It is how we found out about the Johnson & Johnson vaccine causing those clots in the brain in a very small number of women. So those cases do concern me. Those very, very few cases. Some of those women died, less than you could count on one hand. Some of that was due to misunderstanding of what they had and giving them heparin, which was contraindicated in this type of clot. So that said, it's still serious, and I feel for them and for their families, but those are a handful of people. And it's very, very hard to do this, but you have to weigh that against all the countless, really countless, multiple digit lives that have not been lost because they got the jab. The people who didn't end up in the hospital or end up in an ICU in an alternative reality if we turned back the clock and didn't have the vaccines. So really, it's been remarkable. And when we talk about the mRNA vaccines, we don't even have those clot issues. That's J&J and the AstraZeneca vaccines, both adenovirus vector vaccines, which we didn't talk about, but those, AstraZeneca is not used in the United States. So really for the mRNA vaccines, I'm unaware of any direct relationship between that and death. Now, neurological issues are always a concern. Because people can get Guillain-Barré or Bell's palsy because their immune systems get revved up to any vaccine. So this is true of anything. So if you're skeptical of this for the COVID vaccines, you should be skeptical of this for the shingles vaccine and for the flu shot and for mumps, measles, and rubella. Look, this is tough. But when we look at the preponderance of all the benefit, how many people in the country die from a penicillin reaction every year? Or from a cephalosporin reaction? Antibiotics kill people. Does that mean we shouldn't use antibiotics? Doesn't the greater good really weigh us down towards the side of we need antibiotics, even though we know some bad things can happen very rarely? This is even rarer than an antibiotic side effect. So I know it's hard, and I know people sometimes are trained to be skeptical, and I think that's a great thing about us. But in this case, I think it's a double-edged sword. And we really have to start facing the reality of the evidence around us, as so many people are. They just said, I didn't want to be the first one, but why not be the 201st millionth person to get it? If you're not going to be the first one, you might even have to be the 100,000th, but now you're going to be the 250th millionth person to get it. I think that's a lot of data. Look, I'm voting with my feet. I got the vaccine. I'm going to get a booster soon. My kids have been vaccinated. If I could get my cats vaccinated, I'd vaccinate them. I'm all for this. People who invent vaccines go directly to heaven because they save so many people's lives. My dentist husband helped invent a Haemophilus influenza vaccine, and I always tell him he's going to heaven because there's nothing you can do that has a greater scale of good than vaccines. And the people who benefit from them don't even know they benefited from them.
Thank you so much, Dr. Wall. And thank you to all of our panelists for answering all of these questions today. That's all we're going to do for this session. Thank you so much for joining us, and thank you all for your questions. We really, really appreciate you being here with us. If we did not get to your question, we will work to answer it in other formats. And again, we will be sharing this recording as soon as possible. And if any other questions arise in the meantime, please email them to covid-19@unchealth.unc.edu. Thank you, and everyone, please have a good afternoon.